Welcome to our presentation on Orlistat in obesity management. We'll explore its mechanism of action, indications, contraindications, efficacy, and adverse effects. Let's delve into how it can aid in achieving weight loss goals. The global obesity epidemic is on the rise, fueled by our sedentary lifestyles and calorie-packed diets. This crisis is leading to serious health issues like diabetes, hypertension, and heart disease. While lifestyle changes are key, many are turning to medications for help. One option is Orlistat, an FDA-approved drug that reduces fat absorption. When paired with diet and exercise, it can promote modest weight loss. This presentation is for educational purposes only. Orlistat is a gastrointestinal lipase inhibitor used in obesity management. Approved by the FDA in 1999 as Xenical, and later as the over-the-counter version Alli in 2007, it reduces dietary fat absorption by approximately 30%. Orlistat works locally in the gut, minimizing systemic absorption, making it a targeted option for weight loss. Orlistat is indicated for weight loss in patients with a BMI of 30 or higher. It is also suitable for those with a BMI of 27 with comorbidities like diabetes or hypertension. It is used alongside a reduced calorie diet and lifestyle changes for weight management. The mechanism of action of Orlistat involves inhibiting gastric and pancreatic lipases, preventing the hydrolysis of triglycerides into absorbable free fatty acids. This results in about 30% of dietary fat being excreted unchanged. Orlistat acts locally in the gastrointestinal tract with minimal systemic absorption. Orlistat has a low bioavailability of 5%, with minimal systemic absorption. It acts within 24 to 48 hours, with effects lasting 48 to 72 hours. The drug is protein-bound at 99% and metabolized in the intestinal wall. Excretion is primarily fecal, with 95 to 97% eliminated through feces. Orlistat is available in two forms: Xenical, a 120 mg prescription capsule, and Alli, a 60 mg over-the-counter capsule. Xenical is for adults and adolescents over 12, while Alli is for adults over 18. Both are taken 3 times daily with meals containing fat, ensuring optimal efficacy. Orlistat dosing involves taking 120 mg of Xenical or 60 mg of Alli 3 times daily with meals containing fat. If a meal is skipped or contains no fat, the dose should be omitted. This regimen helps maximize the drug's effectiveness in reducing fat absorption. For optimal results, Orlistat should be used with a reduced-calorie, low-fat diet, keeping total daily fat intake below 30% of your calories and distributing it evenly across meals. Due to decreased absorption of fat-soluble vitamins, a multivitamin is recommended at bedtime or at least 2 hours after Orlistat. Orlistat is approved for long-term use, but effectiveness and tolerability should be periodically reassessed. How effective is Orlistat for weight loss? A clinically significant weight loss is 5% or more of body weight lost in a 6 to 12-month period. Orlistat typically produces around 2 to 3 kilograms, or about 2 to 3% greater weight loss than placebo at 1 year, and about 3 to 5% more weight loss over 1 to 4 years, as demonstrated in the Xendos trial, which also showed reduced incidence of type 2 diabetes. Additionally, Orlistat improves LDL cholesterol and modestly lowers blood pressure. However, compared to GLP-1 receptor agonists like semaglutide and liraglutide, which achieve about 10 to 15% weight loss, Orlistat is less effective, averaging only about 5 to 7%. Newer dual incretin agents such as tirzepatide demonstrate even greater efficacy, achieving 15 to 20% or more weight loss, setting a new benchmark in obesity treatment. Compared to other weight loss medications, Orlistat offers a unique mechanism by inhibiting fat absorption. While it results in modest weight loss, it is less effective than agents like phentermine topiramate or semaglutide, which offer greater reductions in body weight. However, Orlistat remains an affordable, non-systemic option for weight loss, though its use is limited by gastrointestinal side effects and modest efficacy. Newer agents are more effective but costly. Discontinuation is advised if 5% weight loss is not achieved within the first few months. Common gastrointestinal side effects of Orlistat include flatulence, oily stools, fecal incontinence, and increased defecation. To prevent these, it's crucial to reduce dietary fat intake to less than 30% of total calories and distribute fat evenly across meals. Orlistat can lead to deficiencies in fat-soluble vitamins A, D, E, and K. To prevent this, a multivitamin supplement is recommended, taken at least 2 hours before or after Orlistat administration, ideally at bedtime. Orlistat may increase the risk of kidney stones due to oxalate nephropathy. Orlistat inhibits fat absorption, leaving unabsorbed fatty acids in the gut that bind to calcium. This action reduces the amount of calcium available to bind oxalate. As a result, more free oxalate is absorbed into the bloodstream, leading to hyperoxaluria and an increased risk of oxalate nephropathy. Prevention includes adequate hydration and a low oxalate, moderate calcium diet. Avoid high oxalate foods like spinach and nuts, and favor low oxalate options like seafood, avocados, low-fat dairy, and apples. Liver injury is a rare but serious side effect of Orlistat. Patients should report symptoms of hepatic dysfunction such as jaundice or dark urine. If these occur, discontinue the medication immediately and conduct liver function tests to ensure safety. Orlistat can cause leukocytoclastic vasculitis and severe allergic reactions like anaphylaxis. Prevention involves careful patient selection and early recognition of symptoms. Discontinue use promptly if any signs of vasculitis or allergic reactions develop. Other reported side effects of Orlistat include an increased risk of osteoporosis, irregular menses, anal fissures, anxiety, headaches, and pancreatitis. Monitoring and managing these potential effects are crucial for patient safety and treatment success. Contraindications for Orlistat include chronic malabsorption syndrome such as celiac disease, chronic pancreatitis, cholestasis, or severe cholestatic liver disease, pregnancy, lactation, hypersensitivity to the drug, and a history of oxalate nephropathy or recurrent calcium oxalate kidney stones. These conditions require careful consideration before prescribing Orlistat. Orlistat interacts with several drugs including cyclosporine, warfarin, and levothyroxine. It lowers cyclosporine absorption, diminishing its therapeutic effect, so doses should be separated by at least 3 hours. With warfarin and other anticoagulants, decreased vitamin K absorption can increase INR and bleeding risk, necessitating close monitoring. Orlistat also reduces levothyroxine absorption, so doses should be separated by at least 4 hours and thyroid function monitored. It can reduce the absorption of fat-soluble vitamins and affect the efficacy of other medications. Monitoring and adjusting dosages may be necessary to avoid adverse interactions. In summary, Orlistat is an FDA-approved weight loss medication for patients with a BMI of 30 or 27 with comorbidities. While less effective than newer agents, it remains an affordable option. Side effects are mainly gastrointestinal, and multivitamins are recommended to prevent deficiencies.
For more educational content, like, share, and subscribe to Quick IM with Dr. Aid. Your support helps us create even more valuable content for you.